Lyme disease complications. Definitions. Lyme disease is caused by four main species of bacteria: Borrelia burgdorferi and Borrelia maljoni. Cause Lyme disease is the unique status, while Borrelia axelli and Borrelia garini are the leading causes in Europe and Asia. The most common tick-borne illness in these regions. Lyme disease is transmitted by the of an infected black-legged tick, commonly known as adder tick. Star. This is video.
It is extremely important such as ALS, multiple sclerosis, dementia, or other neurodegenerative diseases be properly tested for Lyme disease. Lyme disease can present a clinical picture identical to all of these illnesses. All of these individuals must be properly tested for Lyme disease. And if they've been tested in the past for Lyme disease and the diagnosis was excluded, we must determine if the testing was valid, because proper testing will pick up cases that have been excluded. It is extremely important that Lyme disease be considered because there is no effective treatment for the neurodegenerative diseases, whereas the infection with Lyme disease is treatable with appropriate antibiotics. In the other videos included in this series, I will go into more detail regarding the proper testing and the concept of chronic Lyme disease.
It says applications in nursing. Some ticks carry a type of bacteria called Borrelia burgdorferi. If you victim infected ticks, this microbe enters your bloodstream and can make you sick with an illness called Lyme disease. It is the most common illness carried by ticks in the unique status. It can damage any organ or foreign body. That includes your nervous system and brain, hair, and joints. Lyme disease can be to diagnose early symptoms such headaches and body ashes are often mistaken for other health problems. In your Lyme disease info soon after you've been infected, your doctor will start you on antibiotics, doxycycline, amoxicillin, cefuroxime. To play. This is the video. Lyme diseases.
Probably didn't know about Lyme disease. Number 1, contagious ticks are tiny. They're often the size of a poppy seed, but they can be so small that they're essentially invisible. Some are smaller than a pinhead, which is approximately 4/100ths of an inch. Because of their size, they're often hard to locate and remove. Number 2, contagious ticks can take up to 48 hours to transmit disease. Sometimes we think that if we get bitten by a tick infected with Lyme disease, we are automatically infected as well. But that's not true. It takes 24 to 48 hours for the bacteria to make its way into the saliva of the tick, and consequently into your bloodstream. So if you remove ticks immediately after hiking or doing anything outdoors, you have an incredibly low risk of infection. Number 3, a bullseye rash sometimes appears. A commonly known symptom of Lyme disease is a bullseye-shaped rash originating around the tick bite. Most often it is red at the origin of the bite, followed by a ring of normal skin, and then another ring of red skin. However, this symptom is much less common than what is popularly believed. Less than 20% of Lyme disease victims have this symptom. Expecting this symptom to always appear is dangerous because it can cause victims to delay treatment. Number 4, Lyme disease can be transmitted to babies by pregnant mothers. Most often, the disease is transmitted during childbirth, and it can cause debilitating or even fatal birth defects. A concerning 20% of babies with infected mothers will be infected during childbirth. Number 5, cases exist everywhere. Lyme disease is not a localized disease. Cases have been reported in all 50 states and in every continent except Antarctica. Number 6, Lyme disease is sometimes referred to as the great imitator because its many symptoms imitate other sicknesses, making it hard to diagnose. There are over 300 varying symptoms affecting the skin, nervous system, joints, muscles, heart, and eyes. Diagnostic tests exist, but they are incredibly inaccurate. In some cases, patients get false positives or negatives for years before it is determined what's actually going on. This is another reason Lyme disease is often misdiagnosed. Number 7, children make up 25% of cases. Because they spend so much time outside, it's easy for children to pick up ticks without ever realizing it. And because of their age, Lyme disease can sometimes cause serious complications. Number 8, health insurance often doesn't cover treatment for Lyme disease. There may be several reasons for this, but it's sometimes claimed that chronic Lyme disease is a diagnosis used by doctors to describe unexplained symptoms, which is associated with expensive experiments and treatments that insurers don't want to cover. Number 9, although rare, Lyme disease can be fatal. From 1999 to 2003, 114 death records were due to Lyme disease. However, all but one record also had underlying heart conditions or their medical records weren't consistent with Lyme disease. That means that only one person died from Lyme disease alone during that time. The other 113 likely died due to complications relating to Lyme disease. Number 10, there is no approved vaccine for Lyme disease. In the mid-1990s, trial vaccines were being used, but they were only safe for people who were 15 years old or older, and only 80% got immunity. The vaccines were discontinued when claims were made that they caused autism, and a new vaccine has never been approved. Well, I hope you enjoyed that video. Have you had experiences with Lyme disease? Tell us about
Pros and cons. Taking doxycycline for Lyme diseases is over a highly beneficial treatment, and the drugs is given to patients weeks, hours of the initial TB that causes Lyme disease. It has been shown to prevent the development of diseases. The only thing it is not suitable to use doxycycline for nerve damage as a result of diseases. The common side effects associated with doxycycline include diarrhea, sore and itching of the rectum or the vaginas. Play to video. Sweet applic in Ecuador. Lyme disease is multi-system infectious. Disease causes basic burner pyrocheck. Borrelia burgdorferi as involvement occurs frequently. Meningitis, multiple cranial nerve palsies, neuropathies, radioculus, and encephalopathies are particularly common. The diagnosis should be done carefully. Epidemiology, clinical factors, and laboratory findings are the basis in the management of diseases. In is the paper presents in 6 years old. Ecuadorian boy with fully diagnosis. Parameters for Lyme disease according to the American Academy of Neurology. This is the first report cause of diseases in Ecuador. It is necessary to carry on epidemiological studies to confirm the occurrence of these conditions and the look for the presence of the transmitting vector in us caused agent in its country. Este video.
Thank you for joining me. Today we're talking about chronic Lyme disease. We just recently published an important paper on Lyme disease, which cites 157 different peer reviews. And within the paper, I believe it to be the first paper that really correlates chronic Lyme disease with fibromyalgia, chronic fatigue syndrome, Parkinson's, rheumatoid, and it really rheumatoid arthritis, and it brings it together in an overview so that patients and doctors alike can take a look at it. We published the paper in the Open Journal of Medical Microbiology, and inside the paper we talk about a few key things. I'm just going to give some highlights. I'll leave a link so that you can visit and read the paper on your own time. It talks about the genome of the infection, first of all. This is the most complicated bacteria in the world. You heard me. It's very complicated, and it's no surprise to us why a number of doctors misdiagnose it, aren't able to treat it properly because it's highly complicated. And I'm just going to point out a few key things within the paper that I think are quite interesting. We discussed the cellular process of the infection, but one of the big ones is the evasion of the immune system. Borrelia sheds its antigens, kind of like a snake that sheds its skin, making it hard for the immune system to spot and treat it effectively. And it just can do this. It shifts its surface antigens in such a way that the immune system can sometimes be useless in treating it unless it's targeted properly. And I think that's an important part. Also, in the understanding of the spread of the infection or the epidemiology, this is in many doctors' backyards, and they don't even know it's there. And it's really important to understand, the clinical diagnosis of the infection, how to do that, besides just what CDC gives us. And understanding chronic Lyme disease's full symptoms, how it affects the neurological system, the brain, the cardiac, the joints, the fatigue, and so forth. And I think we give a good review of what's in the cited literature regarding these symptoms and what to look for. But one of the things I want to point out that I think is also very important is in relationship to the immune system, understanding CD57 on it. And what I want to point to is and I'm just going to point here to the discussion that we have in the paper. I want you to circulate this. I think this is the most interesting thing. Look at the symptoms. First of all, and if you have any questions, to contact us. I mean, we've been doing this work for over a decade, but we're getting better at honing therapies and technologies. Just want to share some of this data with our colleagues and with patients because we believe that good information in a peer-reviewed journal is starting to get better, and publishing this information is important to really expand the proper treatment of chronic Lyme disease. So I wish you the best of health. God bless you, and if there's any way we can help you, please don't hesitate to reach out. Take care. Have a good day.
Conclusions. The best way to prevent Lyme diseases in your dog is to keep him her from infected debit. Make sure to keep your dog out areas with ticks. For extra precautions, you can check for ticks regularly. This can help keep your dog from Lyme diseases. If you notice any of the symptoms of Lyme diseases in your dog, head to lead veterinary right away. Our confirmations of Lyme diseases in your dogs mean that treatment should be started as soon as possible to prevent further complications. Thank you.